Black Mental Health UK Part 3 of my story. Going back to what I was saying about my children, please be under no illusions. It has been incredibly hard as a person with mental health issues, who's also black, who's also a woman, who's also a Christian, who's also a statistic because I'm a single parent, to raise the children and try and make sure that the cycle wasn't repeated, try and make sure that they weren't touched by my past, by my issues, by my mental health, to the point where I spent most of the past, my oldest is 17 now, most of the past 17 years hiding my mental health issues from my children. I would hide the self-harming, what I, still till this day struggle with. I would hide when I was feeling really down. I would spend long periods of time, 10, 15 hours at a time, in my room, locked away. But I was what was known as a functioning, person with mental health. Like, you have your functioning alcoholic, you have people who are raging alcoholics but still manage to function well enough on a level where they can hold down a job, a good, proper, high paying job, high flying job. They can run a household, they can look after their children, they can still look after and support their husbands without people knowing that they're alcoholics. And I'm what's known as a high functioning person with mental health issues. I would still get up every morning and make sure that they were clean and well dressed and ready for school, and their packed lunch would be done. Dinner would always be cooked when they got home. They'd never have to get home and be like, when's dinner ready? I always tried to keep the house as clean as I could, even though there were days when I just didn't want to touch it. But I spent most of the past 17, nearly 18 years now hiding my mental health from my children because two reasons. One, I wanted them to have as normal a mum as they could possibly get, as I could possibly manage. And two, I didn't want them to grow up and be affected in that way by mental health. I didn't want them to think of their childhood blighted because of mummy's mental health issues. I didn't want it to scar them the way my childhood was scarred, because when I look back now at the way my mother treated me, the things that she did and allowed to happen, she was very much aware of the sexual abuse that was going on. I realise now that I believe my mother had mental health issues, and I think a lot of black mothers who are a certain way or behave a certain way, the problem could be down to mental health issues. But it hasn't been easy. There have been times where I've hated my own children. I have been jealous of my own children because I've looked at them and I've thought, when I've seen how happy they were, whether they were very young or a bit older or as they are now, I look at them and I think, that could have been me. That should have been me. I'm looking at you now and I'm looking at what I could have been and what my life could have been and how good it could have been, and I just have to kind of, accept it, because you cannot change the past. And in terms of where is my mental health now, it is up and down, but it's not in a good place now. My mental health is it's quite bad now, if I'm honest, because I 3 years ago I felt like the Lord, my God, who I serve, had kind of laid it on my heart to start a charity that supports, at first we were supporting single parent families, and then we moved from that because we had a lot of people coming to us, a lot of women especially coming to us and saying, well, I'm not a single parent, I'm married, but my husband works on godly hours and I rarely see him, or he works overseas, or he's in the army, and I feel like a single mother, you know, will you not support me? And we were like, look, we don't turn anybody away, we will support anybody who needs our help. So then we had to kind of change our remit and open it up to just people living in poverty. And the charity, you know, it was doing really well for the first 3 years. I ran that as a volunteer for the first 3 years, because I was looking for a way to get paid to do it, because obviously I was on benefits at the time. I was on employment support allowance, I was on disability living allowance, all these benefits that I was on because I was on quite a lot of medication at the time for my mental health. I was on antidepressants. I was constantly having to be put under the care of psychiatrists and see different people with all my breakdowns and everything. So it was a pretty hard period, the past sort of 12 years. But then, as I said, 3 years ago, when I started to feel a bit better, I started to feel more like myself. That was when I decided that, okay, I feel like this is the direction that God wants me to take. I'm going to start my own charity, and I did, and it took off, and it was really successful. And you know, we had some funding from a private couple who gave us some money, and for the first time in I don't know how long, I was happy. I was so happy. I called my charity Adira, which means strong, noble, powerful. It's a Hebrew name, and it is what we were trying to empower our service users to become, because we did a lot of work with women around domestic violence, sexual violence, rape in their childhoods. We worked with men, perpetrators of domestic violence. We set up a clothing outlet that was, you know, that would sell clothes, shoes, handbags, pots, pans, plates, you name it, to one of the poorest communities in Sheffield, which was the Furvale area. And we set up there, and we did a food bank thing, what we had going, and then we did the clothing outlet, and we sold these things at really ridiculous prices. You could get a brand new pair of jeans for £3 because everything was just donated by the local community. And as the charity grew, I put together a management committee, and I was under a lot of pressure from the job centre to kind of, you know, look, you need to be actively seeking work. And I'm saying, look, this is what I want to do. But I didn't fit into any boxes. I didn't fit into a particular box where they could say, well, okay then. So I said, look, you know, if you give me some time to build the charity up to a place where I can then apply maybe to the National Lottery for funding, then I can get funding, get paid for doing this, get off benefits. You'll be happy, I'll be extremely happy, because I will be doing something I love and enjoy, and I get to set my own hours and work my own hours. We had a breakfast club that we were running in the morning for kids who would go to school without a breakfast. You know, we were really helping and supporting people, and for those 3 years, I think, if I'm honest, those were the best 3 years of my life. I loved it. I did it from 2010 to 2013, 14. And one of the things that we did last year was to put on a conference here in Sheffield, the first ever of its kind, that actually made the local news, and it was entitled Tackling Domestic Abuse in Faith Communities. But I could, you know, as much as we were trying to get funding for me, and as much as we were trying to get it off the ground, we were really struggling to do that. And I knew that it was just a matter of time before we would sort of run out of money. And not only that, physically, I was kind of running myself into the ground, because the bigger Adira grew, the more people we were able to help. But we weren't able to take on as many volunteers as we would like. And the volunteers we did take on weren't always either honest or reliable, or, you know, it got to the point where I was almost a one-man charity, just kind of running this charity basically on my own, really struggling. And coming towards the end of 2014, I knew I knew that, you know, our money was running out, but I was getting more and more physically tired, more exhausted, doing more running around, spending more time looking for funding bids, doing funding bids than actually doing the work, and trying to run my car on benefits. Somebody gave me a car when I started the charity to help me with the charity, trying to run my car on benefits. So I'm paying the tax, the MOT, the insurance, the petrol on benefits. And at the same time still trying to find a way to make a wage. So when the end of 2014 going into 2015 came, and I knew that mentally and emotionally and psychologically I was just exhausted. I was completely exhausted. And then I knew that the charity couldn't carry on because we had sort of run out of money for it, and I'm not good at funding bids. The management committee that I had were also, you know, struggling with their time and trying to, you know, get together. And in January of this year I had to kind of put Adira on hold. That broke my heart because I loved it. I loved it. I loved what I did. I loved helping people. I loved listening to people. I would sit on somebody's floor and listen to them for hours at a time, talk about their problems, and get such a feeling of, yes, I get it. I understand where you are. I know where you are because I've been there, when they would talk about their domestic abuse or their alcoholism or their self-harming or their struggles as a single parent or even in a two-parent family. And to not be able to do that anymore, it really had an impact on me. It had an impact on my mental health. My mental health in January of this year, I kind of had another breakdown. And that's where I've kind of been since January of this year. My mental health has just been up and down. Not really seeing a way out, not really seeing a light at the end of the tunnel, really.